Okay, we're gonna start with this patient. In this case, she has a sagging on the both jaw. So we try to do lifting on the left and right side, but she has a slightly balance on the right and left side. We're gonna try to the right side more and to make a balance. So now I'm just starting with the design. I tried marking the hero and the lifting and draw the jawline. Try with manually lifting, so which area we need. Actually, she has need the vertical lifting on the right side, so we're going to try more on the right side to lift the vertical lifting. And she has also, because of enlargement of the both maxilla, she has the hollow just on the maxilla. So we're going to try to make a volume to fit like this way or like this way. The thread we are going down from temporal to here and here. So this one also. This way and right this way. So I will insert the pipe of a thread, the cork thread, on the both and left and right side, and try with the small Phoenix thread on the vertical thread on here and here. Here and here. Try to make a volume with the vertically, like this way. This cannot be done by the long length, so we're going to try with the short and strong lifting thread, which is a Phoenix. Okay, that is my design. That's all. Okay. I'm going to anesthesia on the face or low face, and actually we can see the imbalance of her head side and left side because of this is caused by the bone deformity. So actually the angle of bone is slightly like deviated. So we try to the lifting on the right side more to make a balance. Okay, first I will inject with the intraorbital lobe. Actually, when you start with the thread treatment, the position is the most important thing. Is that most of doctors they ignore about that, but actually this position is the neck extended and the vertical like this way is naturally lifting. So you don't need to the traction and you don't need to lift the skin by manually. So this is quite natural lifting. So the most important thing is to don't forget about that when you try to treatment. So you have to extend it patient's necks. So it's very useful and make a natural start positions. Okay. Okay, this is the double tie of a cannula with a thread. Now we try with the vertical line. The most benefit of a blunt cannula is that we can avoid that from bruise and pain. Okay, now I insert the line and without. You never try with too much lifting the skin natural shape. So try with the very natural and just feeling like keep the thread itself. Yes, like this way. Maybe you can use that 18 gauges of needles to puncture it, but I strongly recommend about that. Use the hour. This is also avoid the bruising and avoid the damage of vessels. Okay, to push the end of the cannula tips to retain the thread and slowly withdraw. Try to check the retraction is well done. You can see that the movement of and that means that the thread is grab the skin, is grabbing the skin. So I finish the left side, and then you can compare on the left and right side. To compare on the left and right side before, now she has a retraction, so you can see that the line of jaw is quite narrower than the right side. So this is just after result of thread lifting with a 4 thread. Okay. I'm going to try to the right side again and try to make a balance. And I think so we can insert the more thread compared with the left side. Try to insert the thread on the right side more to make a lifting power more. We have to go through into the smart muscles. So if you have any resistance or any discomfort, so you have to withdraw and insert with a very smooth layer. This is a smart layer, so it's very smoothly you can insert the thread. And just try to keep the hand. As a beginner, I recommend that you're gonna start with just in front of a hairline, because that there is a lot of hair, so it's not easy to visible the puncture side and control the thread. So as a beginner, so you're gonna just start with a line in front of the hairline. But if you have experience, maybe you can go backward. puncture. And if you insert in the proper area, the resistance will not be felt so much, so it's gonna be more easier. Okay, I did in the right side. You can see the small dimpling on the side, but we will release that. Don't worry about it. After 1 or 2 weeks, it's gonna be spontaneous. Will be disappeared, but it looks severe. You can release by manual. It's okay. So, but generally now we can make a balance on the right and left side. I call that this is a retouching. So slightly we can make a volume and the lifting on the right side more. So I'm gonna try with the right side and thread rotations. Much more as you want. Maybe 5 or 10. And you can see this thread also lifting that after cut. When you find it just after treatment, so if you find it dimpling, so you can improving just the manual by manual you can fix it. don't worry about it. Slightly small dimpling will be subside after 1 or 2 weeks later. It's spontaneous, so you just recommend about it. Don't touch to client. Don't touch that. Just keep it and wait. So now I'm gonna try with the under chin to 15 the under chin to make a sharp jawline like this way. So we can do with a Phoenix with a long mid. The most important thing is when you treat it on the under chin is that the leveling depth of the thread is most important, because actually this is quite long and not easy to determine the depth. So try with your left hand and try to go through the evenly and horizontally and go, and not too shallow and not too deep. And as a beginner, so try with the shorter one first and get your experience, so you can do with a more longer. Okay, now you can see that it's the same kind of thing. When you cut the thread, try to avoid the extraction of a thread, and the retraction with the thread, and you can push the skin and cut inside of the skin. And massage with the gently. Okay, this is the end of treatment. I just try to balance and control the retraction power to balance and the left and right side. Especially he has word on the right side, so I try to make a volume on the right and left side more.